Other groups have done guidelines, but nothing comprehensive. So first of all, this is the whole thing. Everything from defining high blood pressure to how to evaluate, how to measure blood pressure, lifestyle changes that can help treat the blood pressure, lower it, drug therapy, how to choose drugs, what tests providers should do, all of that. There are now enough studies to support lowering those targets, and so the whole definition of high blood pressure has changed. So the change is above 120, and systolic, the systolic or the upper number is the key number that more of this is focused on. But 120 systolic and 80 diastolic would be the numbers that people want to know. If your blood pressure is at that level or lower, you have normal blood pressure. The difference is if you're between 120 and 129, and still 80 or lower on the bottom number, but your upper number is 120 to 129, that's now called elevated blood pressure. It used to be high normal, but still had the normal term in it. Now it's elevated blood pressure. And so that will get people's attention a little more that, hey, this isn't normal. The real difference starts at 130. So if you have a blood pressure of 130 to 139. That used to also be high normal. Now that's stage 1 hypertension. So that is a change that's really, everyone always thought of 140 and 90, but now it's 130 to 139 is stage 1 hypertension. So that's going to be a big deal. Then at 140 and higher, and at 90 and higher, then it's called stage 2. Now that used to be stage 1. So people will say, oh my, this is more severe. And so that will be a more noticeable change as well, that 140 is now stage 2. So if somebody has a blood pressure over 130 and over 80, and they have a cardiovascular risk that's elevated in that 10% or higher range, then we would recommend they start medication at that stage 1 level. If they don't, if that risk is lower, then the recommendation will be lifestyle changes. And so there will be more emphasis on starting those lifestyle changes and monitoring the blood pressure to see if it responds to those changes without necessarily going on medication. And the surprising finding in that study is that they randomized over 9,000 people to a blood pressure target of less than 140, which would be the standard at the time, or less than 120 millimeters mercury, which is quite a bit lower. They found that the people in the lower target group had fewer cardiovascular events and a lower risk of dying. And so that was really a big deal. And that changed the landscape so that we started to focus on, okay, we should be going lower.